Did you know that Turner syndrome is only seen in approximately 1 in 2,500 females? But what is Turner syndrome? Turner syndrome is a genetic condition that occurs when an X chromosome is missing or is partially missing. The diagnosis of Turner syndrome can be given at several points within the first few years, before birth, during infancy, or in early childhood. Turner syndrome can be suspected prenatally based on a prenatal cell-free DNA screening. Diagnosis is confirmed by a blood test called a karyotype.
So, what does a female with Turner syndrome look like? They may have a shortened height, heart defects, and the failure of ovaries to develop. Let's break down the symptoms into 3 categories. Before birth, the following may be seen through ultrasound: swelling on the back of the neck, heart abnormalities, and abnormal kidneys. At birth or infancy, visible symptoms may include a wide neck, low-set ears, broad chest, narrow fingernails, swelling of hands and feet, low hairline at the back of the head, a small lower jaw, high arched palate, and short fingers and toes. As the female continues into childhood or early adulthood, growth will be slow with no growth spurts. There may be a failure to begin sexual changes that occur during puberty, like menstrual cycles. As the female continues into adulthood, they may have the inability to conceive a child without fertility treatment. Women may also experience high blood pressure, kidney problems, and an underactive thyroid.
Remember, not all of the symptoms of Turner syndrome may be noticeable. Females with Turner syndrome may exhibit speech deficits and could be referred to a speech-language pathologist. A majority of speech therapy may involve improving their feeding abilities. They may show signs of difficulty with eating, swallowing, and drooling. Articulation and fluency is also targeted in order to help improve their speech clarity. Due to their high arched palate, some sounds may be difficult to say. Females with Turner syndrome can also have hearing impairments, which can make their speech sound muffled. Small sinuses may result in a blocked nose, causing speech to sound nasally. An SLP will work on the client's resonance, which will impact the pitch and volume of their voice. A female may also present with language deficits. There may be difficulties with narrating past events or retelling stories. Other deficits include processing information, abstract concepts, repeating questions, following directions, and a lack of spatial awareness.
You should also consider seeing the following medical professionals: PT, pediatrician, OT, cardiologist, gynecologist, a primary care physician, endocrinologist, and a nephrologist. You may also want to consider speaking to a counselor to help build your self-esteem and to discuss your concerns about your diagnosis. You can join a support group for females with Turner syndrome. If you are a health professional, understand that not everyone will present with the same symptoms. So remember to treat the symptoms, not the disorder.
As a family member or caregiver, it's important to understand the deficits of Turner syndrome that could give the best care to your loved one. Regular checkups are needed throughout their lifetime. It's also important to remember that this condition can leave your loved one feeling insecure.
Remember to keep their feelings in mind and help raise their spirits. Help her see her strengths and remind her that her challenges do not define her. Arrange your home so it is comfortable for her. Encourage her to participate in activities or volunteer work. While Turner syndrome presents with a variety of health-related difficulties, never forget that females living with this disorder can live a long, happy, and healthy life. Thanks for listening!